Today, an operational demonstration of the Intertan Intramedullary Nail instrument set is being conducted. First, the guide wire is inserted using the access sleeve. There are 3 holes on this component. If the guide wire placement through the first hole is unsatisfactory, the second or third hole can be used to reinsert the guide wire. Tilt at an angle of 5 degrees toward the lateral side of the femur. Insert the guide wire. Remove the guide wire sleeve, then proceed with canal opening. Use the entry reamer. Insert the guide wire through the cannulated channel of the entry reamer to perform preliminary canal opening. Use the proximal reamer, guided by the guide wire, to perform proximal reaming. After reaming is completed, remove the reamer. Use the reduction rod to achieve fracture reduction. Insert the reduction rod into the medullary canal until it reaches the distal fracture site to achieve reduction. After reduction is achieved, remove the reduction rod. Use the flexible reamer to perform deeper distal canal reaming. After reaming is completed, remove the flexible reamer. The femoral head guide wire remains in the medullary canal. Next, install the main nail. Use the tensioning bolt to lock the main nail. Use the T-handle quick release to connect the femoral head hex wrench and tighten the main nail. Insert the main nail into the medullary canal. After the main nail is inserted, install the proximal targeting device. Press the button on the aiming guide and insert the proximal sleeve. Withdraw the femoral head guide wire and proceed to target the proximal hole. Insert the guide wire using the guide wire sleeve. Ensure that the curved surface of the guide wire sleeve faces the smaller hole. Advance the guide wire into the bone along the sleeve. Use the cortical drill to pass through the proximal screw sleeve and drill to the depth limiting mark. Withdraw the cortical drill and manually insert the anti-rotation pin. Then, remove the guide wire sleeve. Advance the proximal cortical drill along the guide wire to perform drilling. Remove the proximal cortical drill and use the tap to pre-thread the hole. Use the inserter to tension the female screw and implant it into the cortical bone along the guide wire. Ensure that the concave curved surface of the female screw faces the smaller hole. Loosen the tensioning screw and remove the inserter. Use the hex driver and tensioning screw to tension the male screw. And connect it to the T-handle quick release. Withdraw the anti-rotation pin. Insert the male screw through the small hole of the proximal sleeve. During insertion, a sudden increase in resistance accompanied by backward movement of the female screw wrench indicates the onset of compression. After implantation is complete, remove the proximal sleeve. Perform distal screw insertion. Connect the distal targeting guide to the handle and secure it with a locking nut. Insert the distal sleeve and use the soft tissue protector to retract surrounding tissues. Connect the bone drill to the quick release handle and insert it into the sleeve to perform drilling. Insert the screw using the hex driver and tension it with the internal rod to lock it in place. Connect the T-handle quick release to insert and lock the screw. After implantation is complete, sequentially remove all instruments. Detach the handle from the intramedullary nail. Next, install the end cap. Use the hex driver to tighten the end cap. Then, use the torque wrench to fully tighten the end cap, completing the short nail procedure. Next, demonstrate the distal hole procedure for the long nail. The connection between the handle and the main nail can follow the same steps as the short nail procedure. Install the guide rod and secure it with the locking bolt. Then, install the distal guide rod and secure it with the locking bolt. Next, install the lateral support bracket and secure it with the locking bolt. Insert the lateral support using the positioning rod sleeve. And use the soft tissue protector to retract the surrounding tissues. Next, drill using a 5.2 mm drill bit, followed by a flat-tip drill for hole preparation. Press the lateral support button and insert the positioning rod. Next, proceed with distal hole targeting. First, insert the distal sleeve and use the soft tissue protector to retract surrounding tissues. Use the bone drill, inserting it through the distal sleeve to sequentially drill the holes. Connect the hex driver to the quick release handle. Insert the locking screw, hex driver, and sequentially advance the screws into the bone. The distal hole procedure for the long nail is now complete.